in terms of medical and dental, you have this pre-DHA that you have to make sure you complete within 120 days of the expected deployment date as a service member. If you don't know, but DHA is Deployment Health Assessment. And when you return, you'll be doing a health reassessment. So it's very important that you get this information. I mean, you have to get it done, but to make sure that this information you provide on this health assessment is accurate, because it's one of the best ways to be able to tell, having a pre and then having a post assessment of your health as to the changes that may have taken place as a result of the deployment. So it's an electronic form. Obviously, it has to be completed, but there's another component to it, and there should be, unless there was some unique waiver situation, which I've not heard of, but it has to be reviewed and discussed in a face-to-face, or, you know, in the times we're in now, it could actually not be face-to-face, maybe a Zoom or Microsoft Teams or some other kind of video conference format. But it has to be done with a trained and credentialed healthcare provider. So that's an important piece. It's not really as much, you know, on you, but just so you know that that's who the person is who's going to be breaking that down with you and talking about it. So when the service member is called to active duty, and it has to be for more than 30 consecutive days, you automatically become eligible for active duty benefits, and it's automatically enrolled in TRICARE Prime. The family is also covered as active duty family members. And obviously, you know, this is a very complicated arena. So I'm only going to be touching on this. Hopefully it will provoke some questions in your mind as to your specific situation, if it's not answered previously, answered by the information I'm going to provide you, or the TRICARE person will be here providing some more information. So if you're a National Guard or Reserve member, and you're issued delayed effective date active duty for more than 30 days in support of a contingency operation, you are eligible for early TRICARE medical and dental benefits. So again, very unique situation. Not always a whole unit would be in this situation, might be just a few people individually in a deployment, but you have to understand that, you know, you're in a unique situation. So most things then are treated uniquely with and for you. Your effective date for coverage begins on the later date of either of the two dates of either the dates your orders were issued, or 90 days before you report to active duty. So that was either, whichever of the dates is later, the date your orders were received, or 90 days before you report to active duty. So service members should be notified of their eligibility when orders are issued. Eligibility can be verified in DEERS. So this whole eligibility process from TRICARE, and you can always deal with TRICARE directly. So key to make sure that your DEERS is completely up to date with all the right people. So family members have 90 days from the date the service members become eligible for the active duty TRICARE benefits to make any enrollment changes. There may be enrollment change needs based on your individual situation. If you have questions, you should definitely talk to the TRICARE rep, or, you know, actually, you know, I haven't really discussed this a whole lot, but, you know, there's a lot of people in your unit that have relatively recently deployed or are correctly navigating this a couple steps ahead, so you can always lean on each other. USERA protections, which ensure an employer-sponsored health plan can be reinstated. That does not go into effect until the member reports for active duty. So another arena to figure out if that applies to you, if that's something that you prefer. Some people have a unique situation with their work, so you have to figure those things out, especially by letting the employer know well in advance, so that these things can be ironed out. For prescriptions, add the pharmacy phone number to your important phone numbers list. You may be in a situation right now where you have a ton of pharmacy needs, and it's really a part of your whole regimen to have the pharmacy number handy. But for those of you that this is not a usual thing, you're still going to want that. You have no idea what your pharmacy needs might be, and that's going to need to be accessed relatively quickly. Could be just, maybe a simple antibiotic need at some point here. And then while on active duty, service members get most of their dental care from military dental clinics. Family members, though, can sign up for or continue voluntary dental care through the TRICARE dental program. I don't know about you, but there's increasingly brutal dental programs out there as far as insurance goes, where you're paying a ton out of pocket. I'm not necessarily trying to sell it. I just think you should compare what you might get through TRICARE compared to whatever kind of dental insurance that you already have. These questions that you might have now developed should really be saved and asked of the TRICARE rep so that you can get the best answers.